You go to the gym, you eat right, and you might even take your medication religiously every single day. Yet, when it matters most, things feel slower, weaker, harder to control. It's frustrating, isn't it? You start to wonder if your best days are behind you. But here's the unsettling truth. A simple daily habit, something you might be drinking right now, could be the missing link to your performance, or it could be the very thing holding you back without you even realizing it. I'm Dr. Emily Carter, a urologist specializing in men's health. In my clinic, men in their 40s and 50s constantly ask me the same question. Doctor, is there a natural way to get harder erections without just relying on pills? Today, I'm not selling you a miracle cure or false hope. We are going to do a deep dive. I am going to explain exactly how one specific beverage directly impacts your blood vessels, your nitric oxide levels, and your erectile function. We will look at the specific dosage you need and the huge mistake 90% of men make when drinking it. If you want honest, science-backed advice on men's health, please hit that subscribe button. And if you're ready to better understand your body, type yes in the comments below. I read them all. Now, let's start with the most critical question. What actually controls your erection, and why does everything begin with your blood flow? In medicine, we don't rely on social media trends or personal anecdotes, we rely on hard data. And what I'm about to share comes from a massive study conducted by researchers at the University of Texas Health Science Center. They tracked nearly 4,000 men using data from the National Health and Nutrition Examination Survey. Researchers asked a very simple question. Does the daily habit of drinking caffeine impact a man's ability to maintain an erection? The results were undeniable. Men who consumed between 85 to 170 milligrams of caffeine per day were 42% less likely to report erectile dysfunction compared to those who consumed none. To put that in perspective, that is roughly the equivalent of 2 to 3 cups of coffee. But here's the shocking twist that surprised even the researchers. The benefit wasn't strongest in young, healthy athletes. It was actually most noticeable in men who were classified as overweight, obese, or having high blood pressure, the very group that is biologically most at risk for performance issues. This was a major revelation. It suggested that this drink isn't just a stimulant for the brain, it is acting directly on the vascular system, helping to overcome some of the damage caused by weight and blood pressure. However, before you rush to the kitchen to brew a pot, you need to be careful. There is a right way to use this drink as medicine and a wrong way that can actually backfire. So, let's talk about the substance itself. The substance mentioned in the research is, of course, coffee. But it's not just the wake-up feeling that helps you. It's about what caffeine does to your arteries. To understand this, you need to understand how an erection actually works. Most men think an erection is about getting tense. Biologically, it is the exact opposite. An erection requires relaxation. Your penis contains smooth muscle tissue and tiny arteries called helicine arteries. For blood to rush in, these muscles must relax completely to let the floodgates open. Research indicates that caffeine helps trigger a chain reaction that relaxes these arteries. It does this by interacting with adenosine receptors and boosting blood flow. This allows blood to flow in more freely, a very similar effect to how certain ED medications work, just on a natural, milder level. But coffee has another secret weapon: polyphenols. Coffee is one of the richest sources of antioxidants in the Western diet. Why does this matter for your sex life? Because erectile dysfunction is often caused by inflammation and oxidative stress, damaging the lining of your blood vessels. The polyphenols in coffee help fight this inflammation, protecting the delicate inner lining of your arteries, allowing them to pump blood efficiently when you need it most. So you have a dual action tool: caffeine for immediate blood flow and antioxidants for long-term vessel protection. But this is exactly where the trap lies. And this is why so many men drink coffee but still suffer from ED. Mistake number 1, the delivery system. If you are getting your caffeine from a sugary frappuccino, an energy drink loaded with syrup, or by adding 3 spoons of sugar to your mug, you are destroying the benefits. Sugar causes insulin spikes and inflammation, which directly damages blood vessels. You are essentially taking a vasodilator, coffee, and mixing it with a vasoconstrictor, sugar. For your erections, drink it black or with a splash of milk or stevia. Keep it pure. Mistake number 2, the stress response. Many men assume that if 1 cup is good, 5 cups must be better. That is dead wrong. Excessive caffeine, usually over 400 milliliters a day, spikes your cortisol and adrenaline. These are stress hormones. When you are in fight or flight mode, your body directs blood away from your penis and towards your muscles to run or fight. High anxiety creates a biological state where an erection is physically impossible. This is what we call sympathetic overdrive. Mistake number 3, sleep sabotage. This is especially dangerous for men over 40. Caffeine has a half-life of about 5 to 6 hours. If you drink it at 4 p.m., half of it is still in your system at 10 p.m. This destroys your deep sleep. And guess when your body produces the most testosterone? During deep REM sleep. Poor sleep equals low testosterone, which equals poor performance. So the real secret isn't just drinking coffee, it is staying in the Goldilocks zone. Now, before I give you the final prescription, there is a hard truth I tell my patients that often creates silence in the room. Erectile dysfunction is not just a sexual issue. It is an early warning sign of heart disease. Think of your erection as the check engine light for your body. Here's the anatomy lesson most men miss. The arteries in your penis are tiny, about 1 to 2 millimeters wide. The arteries in your heart are twice that size, about 3 to 4 millimeters. That means plaque buildup and vascular damage will clog your penis years, sometimes a decade, before they clog your heart. So, if your erections are failing, your body is screaming that your cardiovascular system is under attack. Many men try to ignore this. They drink coffee to mask the fatigue, forcing their bodies to push through the day using caffeine as a band-aid over a bullet hole. But caffeine cannot fix a clogged pipe. So the real question isn't, is coffee good for sex? The real question is, are you using this drink to enhance a genuinely healthy system? Or are you using it to hide the symptoms of a heart attack waiting to happen? You need to address the root cause: diet, exercise, and stress management. So let's bring it all together. Here's your actionable prescription for today. The dosage. Aim for 2 to 3 cups of filtered coffee per day, roughly 100 milligrams to 250 milligrams of caffeine. The quality. Drink it black or with minimal additives. Avoid sugar at all costs. The timing. Stop drinking caffeine at least 8 to 10 hours before bed to protect your testosterone production. Coffee is a powerful tool for your circulation, but it is just one tool in the box. You cannot build a strong house on a broken foundation. Real performance doesn't come from magic pills or miracles. It comes from consistency. It comes from treating your body like the machine it is. Don't wait until things break down completely to start paying attention. Listen to the small signals your body is sending you right now. If you found value in this deep dive, don't just close the tab. Hit that subscribe button so we can build your health together week by week. You deserve to feel strong, confident, and capable at any age. I'm Dr. Emily Carter. Take care of your body, and it will take care of you. I'll see you in the next video.